Americans overwhelmingly now have health coverage. Highest percent maybe since those stats were kept. And so we do have a portion of the population uninsured, but it's hovering somewhere around 10% or so, maybe a little more than 10. That's a lot fewer people who are uninsured than prior. But the way health plans work, and something that's been a clear trend with employers, it's not your friend, is higher and higher deductibles. And when you seek medical care, you're having to pay a bigger share of that care, bigger dollars than in the past. And so now, according to a report in Kiplinger, more than half of Americans say that even with insurance, that the costs they have to pay strain them so much financially that a lot of people, almost 40%, are not getting the care or delaying receiving it because they dread the bills. And then the consequence is roughly 60% of people end up in worse shape medically than they would have if they'd sought care earlier. I mean, this is a bad trend line. And, one of the weird consequences of it with the employers doing this cost shifting of more and more of the dollars coming out of the employee's pocket is that employers end up paying more later because as people get sicker, the cost of the care becomes more acute because the person's sicker and it costs everybody more money. I've talked before about the role of having more primary care in the U.S. being a key thing to improving people's health and also to reduce overall medical costs. It's weird, but there was a study that found for every $1 spent on primary care, it reduced $10 in expenses downstream. I've only seen one study that said that, and those numbers may be inflated, but it's a clear cause and effect that when we don't treat things early, they get larger later. They don't just go away so often with medical. So I've been thinking about this, and we can't make employers change how they reimburse us because they're suffering too because the cost of healthcare has become so much. So I was thinking about the real key here is shopping around. When you have something that's something you need to attend to, but is not emergency care, it may even be in the category of urgent, you shop. I've talked about this before with simple things like imaging, that if you go shop the marketplace for if you need MRI or something like that, that you can pay so little at freestanding MRI facilities versus one related to a hospital that it's incredible, the price difference. And that's just a glaring example. But with so much of healthcare, thinking through shopping around for something you have to have done is really important to eliminate the big risk you face with bills you can't afford with medical, and also the big risk that I think is bigger of you ending up sicker or possibly dead because you deferred care. So medicine doesn't make it easy. People in medicine hate what's known as price transparency. They hate telling you what something's going to cost. So you have to work at it, but it's worth working at to preserve your wallet and your health.